which is already constituting a huge brain drain. Also, lack of synergy, even amongst practitioners in the health sector, is another big one. But let us begin to look at what the pharmacist can do in strengthening the health institution. Maybe I should start with Dr. Nimi Legemon. Yeah.
All right. Thank you for having me. Like you said, World Pharmacist Day is coming up on the 25th, and activities of World Pharmacist Day usually to, advocate and promote the role of the pharmacist in improving health globally. And it won't be any different for us in River State here. We lined up several programs, but at the community level, the pharmacist is involved in dispensing, is involved in advocacy, is involved in referrals, is involved in immunization, is involved in so many other health programs that strengthens the health system. Health is not credible without medicine, but we've gone beyond focusing on medicines to focusing on what we need to do for the patient, and that's what we'll be focusing during the week.
And that's very critical, particularly when you look at it from the point of view that the role of the pharmacist in healthcare has changed significantly over previous century, from dispensing to providing direct patient-oriented services. But again, those who are in charge of policy, and I'm talking directly, those who are in charge of managing the healthcare system, how much do they recognize on the role of pharmacists, particularly in strengthening our health institution? And I'm going to give you a very clear perspective to this. For example, if you look into River State, we've been building healthcare facilities, and River State government has been saying we have the best healthcare this, healthcare that. But again, knowing the new change in the role of pharmacists, how involved are the pharmacists in all of this? Maybe I should take the chairman.
Okay, thank you very much. You're very correct, but frankly speaking, a lot is beginning to change about the way things are done. Yeah, previously it hasn't been the best way, and that's the reason why we've not done so well in terms of healthcare delivery. But I can tell from all the indications we are getting currently, even from the policies, you begin to look at one of the issues that have dragged so long but has been resolved with the consultancy thing. But again, government has shown goodwill to that. So when you come to those things that usually affect us, frankly speaking, you said very fantastic facilities here and there, but actually are pharmacists involved? And what have they done in the time past? Not so much has been done, but the good news is that we're beginning to have a new leave, a new orientation to
I would actually want you to talk to me about this new orientation, because you see, again, for me, what I also know that pharmacy since origin has expanded its scope and complexity, now encompassing all aspects of healthcare. It would be totally wrong to remove the pharmacist from the chain of healthcare service. Again, so when we are talking about what is on ground in River State, I want you to tell me how this has accommodated the pharmacist, because we're talking about strengthening healthcare service delivery and the role of the pharmacist.
I've mentioned here that one of the things that has changed is the consultancy team, which is what brings the pharmacist closer to the patient, to have a direct contact other than just medication delivery, to know how the patient is doing even while on the medication. Recently, a few things has changed about that positively. And again, let me also say this. I think the practitioners are beginning to also see that the way we are pulled apart in the time past has not helped us. I can say of a truth, especially at the association level, the leadership had found reason to begin to collaborate, to begin to speak in one voice, to begin to chart a course. Let me honestly say that the current NMA chairman has shown a lot of goodwill to bring in all of us working together. And then he go to the ministry, frankly speaking, too, because these are the areas where this narrative needs to change to bring about this needed change. I can also say that at the ministry level, the PANSEC has been fantastic. Again, we now have a new commissioner who has also brought in a new dynamics that has seems to have a lot of positive influence on the system. So I'm saying that those things that had previously been a huge challenge are beginning to be addressed, and very likely is going to turn a new leaf in the way things are done in the
I would like pharmacist Agboma Sonyibe to speak a little bit about that. Again, are you beginning to see a new turn of? I don't expect you to say no. Because again, but you should also understand that we're not talking politics here. We're talking the realities. Because looking at the modern trend of the profession and the need for the involvement of a pharmacist in the chain of healthcare service delivery. So let's look at what is our status in River State.
Okay, thank you. Basically, there's so much yet to be done. Anywhere there's medication, there must be a pharmacist. The pharmacist is the drug expert. From the primary health care facilities, there must be a pharmacist manning every primary health care facility. You're not supposed to dispense drugs, especially prescription drugs, without a pharmacist, because the pharmacist is the prescription auditor. He is the expert as far as drug-drug interaction is concerned, drug-food interaction is concerned. You write the prescription. The job of the pharmacist is not just dispensing. The job is to look at the prescription and pick out likely medication errors, likely drug-drug interactions, or drug-food interaction. There are medications that are not taken with food. You must take 30 minutes before food if you want to get the optimum, response from the drug. There are drugs that are not taken together because when you take them together, you're going to have a negative effect. Alcohol is a drug. Flagyl, metronidazole is a drug. You cannot take metronidazole and alcohol together. The side effect is overwhelming. Sure, you'll be lucky to come out feeling alive. So that's the job of the drug expert. Down to the secondary healthcare facilities, which are the general hospitals, are there pharmacists manning every general hospital? Are there enough pharmacists in the tertiary institutions, tertiary hospitals? Because if from the primary care level, you have pharmacists on ground, the tertiary hospitals can breathe better. So the tertiary hospitals are congested. They're beginning to treat malaria. They're beginning to treat things they have no business doing. They should only do referrals. That is how it should be, starting from there. They're, like you mentioned, the role of the pharmacist has expanded over the years. What the International Federation of Pharmacists, the FIP, talk about is the 8-star pharmacist, even the 10-star pharmacist, who's a lifelong leader, who's an expert in so many things. There are primary health activities or solutions the pharmacists bring to the table. Okay? Like we do ARV refills. What do I mean by ARV refills? Antiretrovirals. When these patients, or clients as we call them, HIV clients, have been stabilized in the hospital, like in the tertiary institutions and the secondary institutions, and their viral load has been suppressed. They are virally suppressed. They are devolved to pre-qualified community pharmacies where they pick up their medications and only go to the hospital twice a year to check their viral load and to check the CD4 count. So you see that the hospitals can breathe, and these people can access their medications anytime, any hour, because the community pharmacy is open at any time, on Sundays, on Saturdays, in the morning, in the evenings. Okay? So wherever there's medication, there must be a pharmacist. Until we get to that level, we haven't started.
One of the things we want to achieve on this program is to sensitize people and to let them know, particularly some dangerous practices that are going on in our society, and also the role of the pharmacist in checking some of these dangerous practices. Of course, we've said that we're looking at also pharmacies in improving the role of pharmacists in improving health indices in River State. However, there are some things that we must talk about because these are very obvious for those of us who assess medical care here in Nigeria. And one of them is the lack of agreement between the pharmacist and the physician. And pharmacist is something you said something about it. Again, it's a very serious one. Though to the novice, they may not see it, but some of us, we see it. So how is that being managed, particularly within our space here?
Okay.
Go ahead.
Let me speak to that. I don't think there's a lack of agreement.
Okay, maybe absence of collaboration. Let me put it that way.
Yes, there are not enough collaboration, you can say. I don't think that if you go to any facility, the doctor can do without a pharmacist. It's not true.
So again, how do we make the collaboration seamless?
I think pharmacists, the promise has already spoken to that. At association levels, we are collaborating. At regulatory levels, we are collaborating. so that we are all working for the patient, not for our individual professions. Now, the health of the patient is the number one priority for all healthcare professionals. So we shouldn't do that, promoting our own personal professional interest at the expense of that of the patient. So there is indeed ongoing collaboration in research in the teaching hospitals. At secondary care level, there are collaborations. So it's not enough, but we believe that we can do more. And this we are doing through at the leadership levels, just like you said, with the NMA, with the Medical and Dental Council, the Pharmacists Council of Nigeria is collaborating. We can do more. It's all for the interest of the patient.
Still talking about the interest of the patient, and there was a story in one of the leading national tabloid some couple of weeks ago where a tribunal suspends 4 pharmacists for practice over violation of ethical standard, and that's very, very key. So again, what are you doing as a body to maintain ethical standard, particularly here in River State?
Okay, let me just quickly speak to that. I'm glad you said that, but I can tell you that that escalated from the regulatory body, which is the PCN. Over there is a disciplinary panel. In fact, it all starts from PSN. If a practitioner that is a pharmacist is found culpable in anything, the body take responsibility to ensure that the right thing is done by bringing that person to book, and from one level to another level until that point. Also here in River State, that's one of the things we are focusing to do, to be sure that amongst us, the pharmacists, we are doing the right thing, especially if that information gets to us. I won't be able to begin to mention names here, but I can tell you for free there have been some persons who, maybe for obvious reasons, have been found to be doing the wrong things, and they've been called to order in certain ways that appears to be not so friendly with them. But freely, I can tell you, we, the professionals, recognize that there are certain rules, and we must apply those rules each time we discharge our duties.
Well, fantastic. If you're just tuning in, you're listening to Point Blank, and I'm speaking to some pharmacists who are members of the Pharmaceutical Society of Nigeria, River State Chapter. Pharmacist Promise Aniele is the chairman of that society, and Dr. Nimi Legemo is the chairman planning week, the Pharmacy Week Planning Committee. Dr. Agboma Ezoibe, I think you were the former chairman or the former
of the Association of Community Pharmacists?
Yes. So Dr. Agboma, pharmacist Agboma Ezoibe is also with us in the studio. So we're looking at the role of the pharmacist in strengthening health care in River State. I would allow 1 or 2 calls to come in at this moment. Perhaps you have a question for the pharmacist in the studio before we begin to look at other issues. 070-5079-1021. 081-174-31021. Those are the lines to call us up on, or you want to send a WhatsApp message to ask the pharmacist some questions. 090-5948-1021. 090-5948-1021. Now, I'm going to allow you to talk a little bit about activities for the week. But just before then, another serious concern is over-the-counter dispensing of drugs, which is a very critical case here. What are you doing as a professional body to stop that? And again, circulation of, I don't even know what to call them, some drugs, I don't even know where they come from. But what are you doing?
Okay, it's one of those challenges that, out there, people just see pharmacy store. They think it's being owned by a pharmacist. It's not true. Part of the challenge we are being confronted with is quackery. All kinds of people getting into the profession to do business and all that. But part of what we have tried to do to be able to check all that is there is a committee by PCN, the PPMV committee, which is saddled with responsibility of making sure that whatever the PPMV are those who are not pharmacists, the patent medicine, who apparently these days try to sandwich themselves into what the pharmacists do. And you find out that when you get to the shelf, there are lists of drugs which they should stock, but these days They stock every kind of thing, both registered and unregistered products, and it's a huge challenge. But in the face of an ordinary person, the person calls the place a pharmacy store because they can put all kinds of names there. So what we have tried to do recently, I think it was last month, we're beginning to put them together by taking responsibility to organize orientation and update lectures for them. And what we're trying to do is to separate the sheep from the goats so that we can be sure those who are registered. And then we're also working closely with the Ministry of Health because there's a state task force, which the Honorable Commissioner is the chairman. Effort is on to bring back that state task force. That is the body that is responsible for cleaning the mess that has been created. So I believe that with the effort of the PCN and then this task force coming on board, it will clearly help to clean the mess in that area.
You know, you've said something very, very important. But again, to the ordinary person, how do I identify? How do I know a genuine pharmaceutical store? All I know is there's chemists. There's chemists. There's chemists here. There's chemists there. How do I know a genuine one?
Okay, thank you so very much. And I was immediate past chairman of the Association of Community Pharmacists.
Yes.
So let me speak about that. One, you walk into a pharmacy, the current license for practice of the pharmacist must be prominently hanged. Must be hanging.
So I should look out for that.
Yes.
I should look out.
If you don't see it, ask for it.
Okay.
Because when the Pharmacy Council of Nigeria comes for routine inspections or inspections, that is the first thing they check. And then you can ask for the pharmacist. And then there's something we call the neon sign, the RX sign, the green cross sign. It should be hanging and it's customized because there are fakes.
Okay.
But it comes with a registration
So how
number.
do I know the genuine one?
It comes with a number. There's a number attached to it. Yes. And then that's neon sign. And then the license of the pharmacist with his pictures or her pictures hanging tells you this pharmacy is owned by a pharmacist, because retail pharmacists are not supposed to be run by non-pharmacists. Non-pharmacists could own.
You've said so much now. Retail pharmacists, and for the benefit of those listening to us, make those clarifications. Yeah.
Okay, the wholesalers, who are the people who receive the drugs from the manufacturers.
Yeah.
A non-pharmacist could own a retail outlet and be a distributor.
Okay.
But a pharmacist must be part of that business. But the pharmacy, the regular pharmacy you walk into to get your anti-malarials, to fill your prescription, is what we call the retail pharmacy outlet.
Okay.
That is where a pharmacist should hold sway, because he doesn't only dispense drugs, he does some counseling. He does what we call pharmaceutical care, which is what is the core of the practice. It's patient-centered. You look at the drugs, you look at the patient. Can this patient take these drugs? And you educate the patient on the likely side effects. You know, you take this drug, in the next 1 hour, you're going to be weak. This is what you should do. This is what you shouldn't do. So it's a holistic thing. Okay? So that's where, so you walk in, you don't see the license for practice displayed prominently. That's not a pharmacy. Query that place.
All right.
Ask for the pharmacist too on duty.
I'm going to ask callers to call in based on what you have said. How many of them even observe this? And this is very, very critical, because you see, we've seen some prominent people die as a result of poor administration of drugs. Very popular people in Nigeria, even some of them using expired drugs. So again, the number to call 070-5079-1021 and 081-174-31021. So we'll take the call. Hello, good morning, and thank you for joining us. Point blank. Hello. We lost that. Faith Fagelo, you're watching us live from Gokana. Thank you so much. And Hillary Sugar, you're also watching us live. Thank you so much. Let's take this one. Good morning. Yes, good morning. Are you there? Thank you so much. Yeah.
From Okega. Good morning, the honorable man in the studio.
Good morning.
I just want to say one thing. Hello, are you hearing me?
Yes, well, we do. Go ahead. Hello.
I just want to ask the. Hello.
Please go ahead. Ask your question. Go ahead.
I just. If you go around the whole state, you see little chemists, little small room, little drink house, anywhere they do commerce. How do they regulate those people? Because most times when you go to those transport shops and you buy drugs, the drugs, when you take the drugs, they are not working. How do they regulate those people?
Okay.
Because everywhere is fake. Everything is fake in Nigeria. How do you regulate those? So those are selling things on the roadside. Right. How do you regulate them?
Okay. Okay. Now, your last comment said everything is fake in Nigeria. That's not correct. Everything is not fake in Nigeria. There are the general. But again, maybe I should allow Dr. Nimi to answer that.
All right. The chairman has already alluded to the fact that there are patent medicine, licenses given to people to operate at rural areas where pharmacies are not available or accessible. But you also find them in the cities. So there's this task force. It's being regulated by the Pharmacists Council of Nigeria. Patent medicine dealership is regulated by the Pharmacists Council. So there's also the inspection committee. So there's routine and regular checks on these things. And if they're found wanting, they have a defined list of medications that they are supposed to stock. If they stock beyond that, they are supposed to be shot. So seals have been put on several of these patent medicine shops for practicing outside the limit. And that's the more reason why you need to assess a pharmacy to be sure that you are getting the proper medication with the proper professional giving you the right kind of education and advice.
Fantastic, Dr. Nimi. I have a question on that. I have a writer, but let me just take calls because the lines are blinking. Hello, good morning, and thank you for joining us. This is Point Blank. Let's take this call now. Good morning.
Good morning, sir.
Thank you.
Yes, my name is President from a little one.
Good.
Can you hear me, sir?
Very well.
Yeah. My question to the guest is this. Because now that she's telling us to check for their own certificate in the pharmacy, they are task force. What are they doing now? When they see this, when they go on the field and then check the pharmacy that don't have those their certificates, what do they do to them?
Okay.
Do they stop them from operation, or what do they do? Because now it's like you are sending us to go and do their own work. So what do they do? Their own task, what are they doing to ensure that this thing
stop? Well, fantastic demand for Eleanor. Thank you so much. We will answer that question. Let's take another one. We have another call here. Hello, good morning, and thank you for joining us. Point Blank. Good morning.
Yeah, good morning, Pastor Segun.
Thank you for joining us. Good morning.
And good morning.
Good morning,
My
sir.
name is Chief Comrade.
Chief Comrade Ironbricks, good morning. Oh, we lost Comrade Ironbricks there. Okay, maybe, yes.
Okay, let me say this. Previously, there was a dichotomy. The patent medicine were seen to not to be properly regulated by PCN because they have argued that they were not pharmacists. But the good thing is that the recently signed into law, the Pharmacy Act, had included them now under the regulation of PCN. I think that is going to change the narrative significantly because this dichotomy had long existed and they were hanging on that wing not to be regulated by PCN. So they grew.
Okay.
But with what had just happened last year, is a new dynamics which has officially empowered PCN to regulate them. So that is going to change the narrative. Secondly, I've also said at the ministry level, the task force for some reason, has not been functioning. And with all the indication that soon that task force will be operational, that again will give impetus to the fight. So I'm believing that by these processes that is on, but once they come into full swing, there will be obvious signs that it's no longer business as usual.
Fantastic. We still have some calls coming in, and Dumebi Ojugbana is watching us from Oyibo local government area, and he said, okay, pharmacists should look into the typhoid craze in Nigeria. I don't understand that. But again, so let me come to your medical outreach. I mean, the programs outlined for the week. One of them is a medical outreach in honor of His Excellency Sasim Life Brand. Maybe the chairman of the planning committee, Dr. Nimi, you want to talk to us about this?
All right. The outreach will take place at General Hospital Opobo. One of the reasons we picked Opobo is that it's a riverine community, and then we need pharmacists to go and see other than Port Harcourt, other parts of River State is easily accessible. Then we also discovered that the General Hospital Opobo, fantastic facility commissioned by the state government, but is underutilized. So we are carrying out the outreach there in order to, attract people to the center so that they can access health. Previously, we learned that people from Opobo were crossing over to Ikotabasi to get healthcare when they have a fantastic facility at the general hospital. So one of the aims is to make sure that people in Opobo get access to the general hospital and utilize it because it's well equipped, and it will indeed reduce the burden of people there.
Fantastic. Again, I realize that you have other programs lined up and you have some very special individuals you have already penciled down. One of them is the Commissioner for Health in River State, the Royal Father of the Day, King Dr. Samuel Amechi, the Oyinshi Aguru, that is the paramount ruler of Igbo Kingdom. So talk to us a little bit more about activities for the week.
Okay, part of our activity, like we start the sports.
Tomorrow.
The sports is built to further strengthen collaboration amongst health practitioners, where we're having sports amongst all these health practitioners, the doctors, the nurses, the med lab scientists, the radiographer. Again, it speaks to the fact that I said the leadership is beginning to see the need for collaboration, to come together, to work together. So that is happening tomorrow at Rivers State University. Then on Monday is the opening ceremony proper. FIP has set aside 25th of September every year to celebrate the effort of pharmacists. Coincidentally, that is the day we are also declaring the week open.
Okay.
So it's supposed to be double events. We are celebrating a world event and then ushering in our own event where we are taxing ourselves to contribute towards changing the narrative in terms of the health indices. Then on Tuesday, the women, the pharmacists, the lady pharmacists are also going to some selected secondary schools to be able to speak to them about pharmacy-related professions and the need to see if that is a career pathway for them.
Yeah.
Then on Wednesday, we're having the outreach, which you have
which we talked about
and which he spoke to.
I also know that we have events for some of this ceremony, for example, tomorrow, and maybe you might just want to mention some of the venue for these events.
Okay, the venue for the event is River State University, the play field close to the Convocation Arena. That's where we'll be having football match between PSN and NMA.
Okay.
That's pharmacists and doctors. Then we'll now have indoor sports, Scrabble, chess, Ludo for other health professionals to participate.
There'll be aerobics for them.
Aerobics, yeah.
It's by 3 p.m.
By 3 p.m. and everybody is welcome for that, for tomorrow.
And also the Monday events, which you mentioned. I think there's also a venue for that.
Yes. Osborne
Lapam.
Okay.
Of Sani Abacha. It's by 12 noon.
Okay.
That's the opening ceremony. The Commissioner of Health will be there and other dignitaries, as you've already mentioned, will be there.
Well, a loaded events you have for this week to celebrate the World Pharmacy Week in River State and also looking at the thing. But quickly, I just want us to talk a little bit. I hope time will permit us because we just have about 3 to 4 minutes. The Dumebi Ojubana are watching us from Oyibo, and she said something which I think we need to talk about. Maybe pharmacist Aboma Izembe will help us. The craze of typhoid. Everybody seems to be having typhoid.
Oh, okay.
I
It's
don't
like
know how that happened.
it's like typhoid and malaria has become this couple that has refused to get a divorce. An unholy union.
Every pharmacist you go to, everybody's talking about typhoid. How correct is that?
Because there are, like I said, quacks in the works. Okay, so you get what you don't even ask for. It's not a case of what you ordered versus what you didn't even order it at all. And then the laboratories. So the Laboratory Scientists Council also has a lot of work to do. Because people walk into the laboratory, they come back with the results. Everybody has malaria and has typhoid. And then this issue of self-medication is a challenge. The average Nigerian is a medical doctor. In short, is a lab scientist, a medical doctor, a pharmacist, and a nurse. Because he walks in and tells him, Madam, I have typhoid. And this is a man who drove all the way from Lagos to Port Harcourt. How do you know you have typhoid?
Some people say I have 2+.
That's why they feel when I get them. So he has already done the lab results in his mind Then he's done the diagnosis as the doctor, and you're still trying to cancel him as a pharmacist. Say, madam, now this one I use now Cipro. Okay, so this issue of self-medication, drug misuse and abuse is a major challenge. Even when the laboratories want to do the right thing, Nigerians will tell them, "You be like say typhoid, they check them. Madam, check when. And so my body go to shake, you go to itch me in a typhoid."
And some will say, "Give me injection."
Yes. So it's a major challenge. It's even the Nigerians themselves, the citizens themselves, that invoke typhoid on themselves. The average pharmacist won't treat typhoid without reason. And there's an algorithm for checking for typhoid, actually.
Okay.
When you do the blood tests, confirmatory test is physics. It's a stool test. If you see Salmonella typhi in the stool, then the person has typhoid. And there are standard definite symptoms. And when people misuse drugs, it's sad because most ailments have the same symptoms or similar symptoms. And that is why kidneys are failing massively in Nigeria. So they keep treating malaria, keep taking drugs that will even make the kidneys fail faster because they don't want to do the right thing. So it's a challenge.
Well, that's a very sad one. But again, maybe we should just allow, in rounding up, the chairman of the Pharmaceutical Society of Nigeria, River State, Promise Anele, just give us maybe one word, again, in line with the week. Then I will also invite the chairman of the planning committee, another 1 minute as we round up. Yes.
All right, thank you very much. The whole essence of the week is that we are looking forward to improving the health indices in River State. And pharmacists are taking up that challenge. And we have spoken to ourselves to say, what do we have to do? There actually is a tax on us while we seek the collaboration of our other health practitioners and, of course, the endorsement of government to help us improve the indices. So everyone is welcome, especially for the sports and the ones we're invited to join. To please join us while we chart a new course in terms of health delivery in River State.
And thank you so much. And to you, Dr. Nimi Legemo.
Yes, the Pharmacy Week is an opportunity for pharmacists to learn because there will be a keynote speaker on Monday on the World Pharmacist Day, so that there are rules that we can assume to improve the health indices. So it's an opportunity for the pharmacists to be enlightened, and also to unwind, because there will be a dinner night and there will be a reward for excellent practice. We will recognize that at the award night on Friday night. And not to forget that we are also assisting traditional medicine practitioners. There's going to be a workshop for them, because I can tell you that a lot of Nigerians access traditional medicine, and we want to help with the traditional medicine practitioners what they can do to maximally and safely deliver traditional medicine. We shouldn't discountenance traditional medicine. And that should be an integral part of the health system. So we're doing a training for them so that they can also assist in improving this health indices in the state. So it's going to be a wonderful.
And that's a very important one, because I also realized that the present administration has also proposed a collaboration between the traditional medicine practitioner, the physician, and the pharmacist. And someday we'll bring all three to River State. We'll bring the leadership of the traditional medicine practitioner, the pharmacist, and the physician. We'll bring them to this studio, because just like you said, there must be a collaboration in improving the health indices. Again, I must thank you so much. And I wish you well as you celebrate the World Pharmacist Week, and also as you help to improve the health indices in the state. Thank you so much, pharmacist Aboma Izanibe. Thank you so much.
Thank you.
Dr. Nimi Legemo, thank you so much. And pharmacist Promise Anele, thank you so much.
Thank you very much.
We do hope